Welcome. Hello, I'm David Allen, PVC Executive Dean of the University of Exeter Business School. And again, welcome to this, our first webinar in the COVID-19 Thought Leadership Series, which we've designed to give Exeter alumni worldwide the chance to discuss with leading academics in the business school, right? The pandemic. These academics who are putting their energy and skill into understanding the pandemic and thinking about what it means for us and how we can respond. Before introducing Professor Julian Jamison, today's speaker, I was asked to say a couple of things about the business school. I know all of you know some about the business school, so I'm going to keep this quite brief. Pre-COVID-19, the business school was set to grow another £15 million in the next year, and had 25 staff. This comes on opening up in London with an innovative digital economy group. We are about to become the UK hub for circular economy. We have a funded research center which will lead a £25 million UKRI research project. We're the market leader in senior leader MBA apprenticeship program, with clients like JP Morgan, Goldman Sachs, UBS, Bank of England, Visa, and others. We have a new proficiency in entrepreneurship program, and we were about to build what we call the creative quadrant area for students and staff to work on new and exciting projects, as well as lots of other wonderful things. Then, as we all know, in March, we had to shut down for COVID-19. As a business school, as a university, and as many universities are around the world, we're working day and night to prepare to teach our students however we will be required to teach them, whatever works in these very challenging times. This is an extraordinary challenge for us and humbling. Like most of you in your work, we're not really sure how everything will turn out, right? But all of us, as all of you here with us today, are doing our best for our families, our communities, right? To make sure that we provide them with the best possible world now and in the future. As PVC and Executive Dean, it's my job to make sure that as the business school, we continue to work forward to achieve excellence and to engage positively with all the members of our community. The alumni are especially important for us. That's all I really want to say about the business school for the moment. I don't really want to take time away from Professor Jamison. Professor Julian Jamison joined us from the World Bank in 2018. Julian holds a BA and MA from Caltech in mathematics, and his PhD in economics is from MIT. But those degrees aren't the reason I was so excited about Julian joining us. Julian represents what I believe is best in economics. The very best economics look very carefully at the most challenging events and problems and try to figure out causes and answers and what we can do. I'm going to admit that I don't understand most of the math, but I do understand and appreciate the work. The best economists like Professor Jamison know how to translate the complicated work they do into discussions that we can all understand and participate in. And I know you will very much enjoy and learn from his talk and the Q&A today. So thank you very much. Julian, over to you. I'm really looking forward to your talk. Thank you very much.
Okay, thank you, David. And thanks everyone for showing up today. It's a bit strange. I have to say, it's a bit new for me as well. I've never given a talk like this before. I miss having people in front of me, but I will try to imagine you there. And I'm looking forward to a chance for a Q&A. We'll definitely keep that part going. So please do, if you have questions along the way, add them to the Q&A box, and I'll try to leave plenty of time for those at the end. So jumping right in, it's great to be here, and I appreciate people joining from all over. So I don't know whether to say good afternoon, good morning, good evening, but wherever you are, thanks for coming today. I can go through the slides. So as David briefly mentioned, there's just a huge amount of research going on in the business school and around the university and around the world on COVID. It's been really quite remarkable. So I'm not going to try to do justice to that, but I will reiterate again, there's a lot going on and people have really stepped up, even with everything else happening in their lives at this point. And there'll be ways to see some of that if people are interested in different aspects. There's a lot out there and we can try to help with that. Just a quick point as a researcher, the speed at which things are moving, although more typical maybe in a medical context, they're moving faster than usual. The vaccine hopefully is coming faster than usual. In a social science context, and particularly for economists, we're not used to moving this quickly, and it's been good for us. I think it's been kind of a jolt to see that this can happen and that we can be policy relevant in real time, which is what a lot of us are trying to do, and still have rigorous, high quality research along the way. I just put up here a link to one website that brings together a lot of different social science related research pertaining to COVID-19. I'm going to focus here on my own work. That's a little bit, biased, but that's what I know best. We don't have a lot of time, so I'll talk about that. I'm going to end up talking about two projects, but I wanted to mention first, and although I won't get into it in the presentation, I'm happy to discuss some of this in the Q&A if people are interested, or I should say up front, feel free to contact me. My information is easily available on the website, so feel free to reach out anytime if you want more about any of the things I'm talking about or what's going on at the business school. So one strand of my research is about development economics. I've done a lot of work in sub-Saharan Africa in particular, and so some of the COVID-related work I've done relates to that. I had an op-ed published in the Washington Post in April, fairly early on, talking about the differential effects of lockdowns in developing countries, and in particular, how it's the calculus is a little bit different there, and probably leads to lockdowns being less appetizing as a policy intervention in developing countries for a variety of reasons than elsewhere. And I did a little bit of work supporting the government of Malawi and their decisions on lockdowns versus not, and where to approach it. I have an ongoing field project, just happened to be out in the field right now with small business owners in Kenya, and we had done a baseline survey right when COVID hit, when the pandemic hit. So of course we're trying to, I hate to say take advantage of that, it's an awful thing that's happened, but from an intellectual point of view, figure things out, partly so that we can turn around and help people from a policy perspective and figure out what to do. So we're interviewing them in kind of real time, but I don't have a lot of results yet from that. So here I'll talk about two projects, and I did want to just mention briefly, this is not the most complicated research in the world, but it doesn't need to be. That's not the goal right now. That's not the point. I think we can still contribute. I hope that it can contribute. So let me just jump right in. The first one is what I'll refer to as the 6-country survey. This was in the 3rd week of April. So after the pandemic had started, after lockdowns and policy interventions had come into play, but still fairly early on. So you have to imagine in your mind what things were like back in April. A lot has changed since then. We've all learned a lot. We're all in a very different position now. So it was pretty early on in all of this. We weren't the first to be doing research, but on the early wave. We're trying to go back now and collect some more data. And it was what I would say is purely descriptive. So it's just a snapshot. Here's what's happening. Here's what people are saying. Here's what's going on in their life. And I'll give you some of the results from that. So it's not an intervention. It's not a complicated model, but it's getting the data out there. And it was across 6 countries, as the name suggests, which hasn't been so common. There hasn't been a lot of research so far where people are doing the same things across the various countries. So our goal was to have inputs to the epidemiological modeling here. So people be able to see what parameters, what's going on, to feed that into the sort of statistic-based modeling that was a little bit divorced, especially early on, from the empirical data. They were running computer simulations, but they needed something to feed into that. So that was one thing we were able to do. To guide policy, of course, to understand the impacts, and in particular differential impacts across different groups. And we made the data public immediately so that anybody can use it, and other people have started to use it since then, which is quite gratifying. And I will mention my co-authors, at least, to say this was very much a group effort, and actually done remotely. Some of us, I'd met some of them before, but some of us had never met before. So we did it all from the start, which was kind of fun. And again, learning to see that that's possible, that we can do that. So what were the 6 countries? 3 from East Asia, China, South Korea, and Japan, Italy and UK from Europe, and then the US. And we had a representative sample of 1,000 individuals per country. In the US, it was 4 major states, so it wasn't totally representative, but it was still pretty representative. and stratified to make sure that we'd be capturing a cross-section, especially with respect to age, gender, income, and in the US in particular, race, to look at racial differences. Age is going to be one of the key ones here, and then maybe income. We know the differences of COVID impact across age, and that's been talked about a lot. So just to point out the obvious, countries have had very different experiences, and when we're hitting in the third week of April, we're hitting them at different times in the pandemic. And so you'll see, sorry, some of this is a little bit small, but the orange line is Italy here. So that's the top at that time. So UK, and of course the US has now way surpassed all the other countries here. But at that time, you're thinking Italy, UK, US is a little bit behind, but China has already hit its peak and started coming down again. And so that was one of the things that made it interesting to us, was to be able to look at different points in time in the pandemic. Although everybody, in theory, had the same information globally, or very similar information. Sorry, on the right, I should have said that's cases. On the left is number of tests. On the right is number of cases, confirmed cases so far. This, again, I'm not going to get into the details on this one. This is just to say this is some of the policy interventions and recommendations. I'll talk about that a little bit more in the second half of the presentation. So by country, the little black mark that's there on its own is the first fatality. So in some places, the interventions are coming after the first death. So in particular in China, where things obviously was very early, things were moving quickly at the beginning. In other countries, you can see Italy there, some things, at least recommendations or local restrictions. In this case, in Northern Italy, were coming in first before the first fatality. And this is different, local and national. Some are just recommendations, some are restrictions. So just to say, there's a lot of different things going on in the different countries, and we're trying to learn from that and see what can we pick up from the differences. So certainly not going to go through all the details here, but the types of things we asked on the survey to everybody: basic background information on the individuals, health status and risk factors. That's important for COVID. Exposure, asking about what happened. I'll give you a little bit of information. One data point on, say, number of interactions, number of people they're talking to at different points in time. Changes in behavior, impacts on their lives, impacts on their income, impacts on their psychological well-being. And then a little bit on beliefs, preferences, and attitudes as well toward the disease, as well as toward the government interventions. So we can see what we can pick up from that. Okay, so here's one I mentioned. This is, and so I don't know how we can see this. I know some people are maybe watching on their phones and other things. I'll try to describe it and hopefully do a decent job. This is the number of close social interactions at work or wherever one goes regularly during the day pre-COVID. So we're asking them retrospectively to try to describe this to us. And what you've got there, the blue on the left is children, the orange in the middle in each case is adults, and the gray on the right is the elderly, and this is numbers. So children have mostly small numbers of interactions, and this is, I think it makes sense if you think about it. Some people imagine kids seeing lots of other kids, but they pretty much just go to school and have their circle of friends, and that's it. And so that's picking up with children with a relatively small 20 or so interactions, whereas adults are more evenly spread out. And the elderly are more evenly spread out. And in particular, if you look at the gray bar all the way on the right, so this is the highest number of interactions, 70, 80 interactions, per week on a regular basis. You have quite a few elderly pre-COVID in that somewhat riskier group. So that's the kind of thing we're gonna ask about and see, does that impact what happens afterwards? Here's a completely basic one. This is change in employment situation. I'll give a slightly more detailed version of this in a moment. Blue is no change, orange is a temporary job loss, and gray at the top is a permanent job loss, at least as far as they can tell, from their predictions at that time. And these are the 6 countries, so China, Japan, South Korea, Italy, UK, US, all the way on the right. So the first thing to say is that the orange and gray bar together is really big. And so this is different than, say, in the US, you'll hear a lot about unemployment numbers, how many people have requested unemployment, and that's important and that's a good thing to know. But this is really a representative sample of asking everybody, not dependent on that kind of data, just going out and seeing what are people saying, what's happened to them. And this orange plus gray bar is really large in a lot of cases. So this is not 10% of people having a serious impact on their employment. This is much larger numbers, up to in China, we are at almost 50%. But also a lot of variation across countries, not too surprisingly, but good to see the numbers and to find out what it is, Japan being the smallest, and we'll see that coming up in a number of the other ones as well. What about differences across income groups in this impact on unemployment? So for some of the countries, there's a clear gradient. So the lower income groups were more affected, more likely to lose their job, at least temporarily. But in other countries, that wasn't the case. There's no such gradient. So the job loss is still going to be more bothersome, have a higher impact on somebody who's lower income to begin with. But the probability of losing the job isn't so different. So here's the data, some data from the US in particular. Again, sorry, this is a little bit, there's some nice colors, but it's a little bit messy what's going on here. So I'll start, so the right-hand panel is income, and the left-hand panel is age. I'll focus more on the income one on the right. The quintiles on the bottom, 1, 2, 3, 4, 5. So this is the lowest quintile, the lowest income on the left, up to the highest income on the right. So the dotted black line in the middle is people who are still working. So this is sort of still have their job as before. And there you see that's pretty flat. Whereas that's sort of the same as before. The red line, the sort of that's going way up, is teleworking. So we asked them, did you begin teleworking? Still have a job, but begin teleworking. And there you see, not surprisingly, a huge gradient. So almost zero for the lowest income group. They don't tend to have jobs. They have service sector jobs that aren't amenable to teleworking, whereas the folks on the higher income end of the spectrum more likely to be able to telework. So there are big differences across income, but overall probability of keeping the job somewhat flat there. And you can see the age difference is somewhat similar on the left. Let's say, again, looking at the red line of teleworking, the younger people more likely to be able to telework, older workers less likely, either choosing not to or not in jobs where that makes as much sense. So again, basic descriptive stuff, but actually getting the numbers out there, getting it sort of as early as possible, or relatively early, and letting people see what they are. Okay, so that's an impact. That's one thing that happened. Here, that's on the sort of more economic side, financial side, employment. What about psychological effects? So you're going to have the countries within each one. Again, left to right: China, Japan, South Korea, Italy, UK, and US. And 5 categories: anxiety, loneliness, boredom, conflicts, so interpersonal conflicts at home, and trouble sleeping. Big numbers a lot of places. Anxiety very high, 50% almost across the board. Trouble sleeping very high, although that's a bit lower in Japan and South Korea than elsewhere. So not surprising. This is not really news to anybody, but trying to see how pervasive is it? What are the actual numbers? Does that vary to what extent across countries? Does it vary across age groups and income groups? And what can we say about that? So maybe surprisingly, not a clear pattern according to income. There are some differences here. I won't go through all the details. So if we look at anxiety in this country, then we see a gradient. But overall, it's affecting a lot of people, and that's been one of the things that's true about the disease. Although physically, the mortality risk, unfortunately, is much higher for some groups than for others, especially elderly and those who have comorbidities. But the pervasive impact on employment, on psychological well-being, on stress, and I'm sure many of us have felt that ourselves, has really been quite a bit across the board. Some differences on age, so on income less so, but a clear pattern across age with more negative effects for the young, or maybe a little bit less stable, have a little more uncertainty to begin with. There are some positive non-financial effects as well. We did want to be fair. We wanted to ask about that. For instance, having more free time for some people, having more time with family, less pollution, less noise. So just, again, to be fair, want to see what's happening. Positive benefits more frequently reported by the higher income groups, especially the reduced noise and pollution, less traffic, those kinds of things. Similar patterns across countries. Okay, so last couple slides of this, and then I'll turn for at least 5 minutes or so, hopefully, on the second project and the second presentation. This is the US again. This is now changes in behavior. So my title slide was sort of this interaction, transmission of the disease, policies of various types from the government, and behaviors of individuals. And that's a little bit the theme. That's where I'm a behavioral economist. These are the kinds of things I'm interested in and trying to explore. This is where I think we can add something to the discussion. So this is 3 different behaviors across income quintile, again, from the lowest income on the left, number 1, to the highest income quintile on the right, 20% at the top of the income distribution. The red line at top is changed any behavior. The blue line in the middle is hand washing and mask wearing, and the green at the bottom is increased social distancing. This is US only. Remember, this is April. Things are, no doubt different now. all of them showing this gradient where the higher income groups are undertaking more changes in behavior relative to pre-COVID, which is how we ask the question. And that, I'm not saying that's sort of personality necessarily. Some of it is being in a position, having the luxury to be able to change some of these behaviors. And that's a little bit we wanted to tease out what's going on with their job situation versus what's going on with their responses and their changes in behavior, and even to ask a little about perceptions. Why is that happening? What are their beliefs around this? Certainly not going to go into detail here. This is just to say for each country, there's 6 plots across country, and then on the left-hand side, for each of these groups of behaviors, we're able to say, at least self-reported, retrospectively, what were you doing in sort of normal pre-COVID times? What did you do at the beginning of the outbreak in your country? And what are you doing now as of this point in April? And so we have those points, and we can see how they vary. Where were they starting? How did they change over time in each country? So here's just one, and I think I'm getting almost to the end of this part, and then set a few minutes on project 2. This is the perceived effectiveness of wearing a mask. So we're asking them, whether do you think it's effective? Do you think it makes a difference as of the information in April? And huge varieties across country. Here, actually, the UK stand out. The Economist magazine picked up on this. I think they liked it, a little bit of a homegrown bias, although the UK isn't looking so good necessarily on this one. So the blue on the left is not effective at all. The sort of dark red burgundy is slightly effective, but not too much. And so the UK is quite large relative to the others. And so the implication there is their belief was that wearing a mask was not super effective relative to some of the other countries. And so maybe some of the reason the behavior is going on is because of that. That's part of what's driving it. So that's the kind of thing we can look at and try to control for. Okay, said that a little bit. Attitudes toward the interventions, generally supportive on government attitudes, attitudes toward government interventions and policies across countries with some differences. Okay, I want to take a few times, and again, maybe 5 minutes or so before we get to the questions, and make sure I leave time for that. I appreciate the patience of everyone so far. So here, very different outcome in this one, but trying to take a bit of a similar approach and look at some of the same issues between behaviors, interventions, and transmission. So we saw governments took different actions at one of the early slides I said, and then a little bit attitudes toward that on the last slide, and at different times. But individuals also took different actions, not just following the government, but sometimes preemptively, self-motivated. Obviously, we want to know which ones worked and why. And there's a lot of epidemiological modeling, a lot of computer modeling and simulations, and that's helpful. That's a good start. But my take as an economist, as an empirical microeconomist, was once we were far enough along, we were doing this analysis in June. We've now got several months worth of data. Let's just see. Let's see what happened. Let's see what happened to the death rates. Again, I want to thank my co-authors, different set of co-authors here who are really helpful for a lot of this. So we're going to look at 13 countries, again, cross-country, take advantage of that. This is all Western Europe. So these are the hardest hit Western European countries, the ones that had the most cases, the most deaths from COVID-19. We want to make a similar context here because we want to be able to compare the interventions, not so much compare the countries. So our underlying assumption, which obviously isn't quite true, is that the countries are broadly similar to each other, and the difference is what happened in terms of personal behavior and government behavior. Our outcome is going to be the growth rate in deaths per day. So we can see that, a lot of good data on that we can use. That's a proxy for the transmission number R, which you've probably all been hearing about a lot. So if the growth rate is 0, that's roughly equivalent to R being 1. So everybody's passing it on, equal number of people getting it each point in time. It's sort of flat. That's a growth rate of 0. If the growth rate is positive, R is above 1. If the growth rate is negative, R is below 1. But of course, it's lagged. And so we put in a lag of 18 days following the medical literature from the median time of being infected to death for those who do die from it. So we're looking at what's the impact of interventions and behavior 18 days later on the change in death rate, and then we can learn whether the behaviors were effective, and if so, how much. And we're going to compare government policies, different closure policies from the government, to voluntary behavior change. So here's our proxy for voluntary behavior change. This is mobility data from Google, publicly available. It's great they're putting that out there at a country level. So here I'm just showing in gray at the top is Sweden, the kind of orange in the middle is the United Kingdom, and blue at the bottom is Spain, but we have this for all 13 countries. And this is a combination of mobility for workplaces, retail stores, and I think we had one other, yes, transit, public transit. So we put those three together. And you can see this drop off at similar times, but not quite the same. So Spain is coming earlier. The pandemic hit a bit earlier there. The orange in the UK is noticeably later, 7 days, 10 days later. And Sweden isn't going down as much. This is all relative to normalized relative to the baseline. Sweden doesn't go down as far. As we know, the impacts weren't as the lockdown wasn't as severe. There was never a full lockdown in Sweden. So that's how we're proxying this individual behavior change, which sometimes comes before the government intervention. So here's daily deaths in Spain, just to take one example. We're going to have the full analysis. You can see they're growing up, 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 up. The orange dotted vertical line is when our mobility measure kicks in. So when the mobility has started to go down. And then the black line is when the official government closure takes effect. And so if you look closely, you can see a little bit of a sort of change in the slope there when the mobility takes effect. Not too much, but it does flatten off a little bit. We're going to run some statistical regressions, not just look at the figures, and then it starts going down when the closure takes effect. The horizontal axis here, so the vertical axis is deaths per day. The horizontal axis is number of days since the beginning of the pandemic in that country, which we define as 5 deaths, basically a running average of 5 deaths. So it's all relative to when things started in that country. So I don't know how you can see the numbers, but the mobility is kicking in at around 21 days. So that makes sense. It sort of becomes salient when there are a number of deaths. People change their behavior at that point, and then it's 18 or so days later that we see the impact on the changes in deaths, on the growth rate in deaths. So what are the results? The mobility reduction, decreases the growth rate in daily deaths by 9.2 percentage points on average across countries. So it means if it had been growing at 10% per day, this brings it down to flat. If it had been flat, this would bring it down to a decline, negative 9% growth rate. So that's declining, as we see in the second half of the graph. The government closure decreases it by 14 percentage points, so about 50% larger. But it was interesting to me that these weren't that far off. So it's larger, not surprising. The closure, some version of a lockdown, has a big impact, but it's actually not that much bigger than the voluntary version. People are responding on their own, not surprising. They're doing something, and that's making a big difference. They're not going out as much. They're not seeing as many other people. They're wearing masks. They're washing their hands. They're socially distancing. If we disaggregate the government closure policy, so that's our just sort of lump everything together, if we look at the different aspects of it, because these were different in different countries and kicked in at different times, it wasn't all at the same moment in each country, the biggest impact is from closing workplaces, non-essential workplaces, so people don't go out as much, restricting large events, I think probably especially indoors, we can't separate that in the data, and limiting travel, both international and domestic travel. Smaller impacts, still positive, beneficial, but much smaller from closing schools and from the really strict stay-at-home orders, which if you're then thinking about policy, may be suggestive for what to do, that we can get 80% of the way there with maybe 20% of the cost and 20% of the burden. And one advantage I would say of this approach is that we don't have a lot of strong assumptions required. So it's really basic. It's like, here's what happened, here's the impact without a lot of modeling, a lot of structural assumptions, although we can't absolutely be sure about the causality from one leading to the other. Finally, we can estimate counterfactuals. We can use this to say what would have happened if things had been different. So just picking 3 of our 13 countries, the same 3, Spain, Sweden, and the UK. The left-hand column is our estimate if there had been no intervention at all of the total number of deaths in that country in the first 50 days of the pandemic relative to that country. You can see very large numbers. Far right column is reality, what happened in the first 50 days. And then the 2 middle columns are if only voluntary interventions, so if this self-motivated behavior change had occurred, but at day 7, so fairly early on. And then the other column is only government closure, but also at day 7. So both of those have a very beneficial impact relative to no intervention, not surprising, brings the deaths way, way down. Both of them are generally lower than what happened in reality. That's because this is what would have happened at if they'd done it at day 7. And in reality, mostly it was much later. And the government closure is stronger, fewer deaths, total deaths than the voluntary. But the biggest difference relative to no intervention, or even in most cases relative to reality, is the timing. So even the voluntary only, if you'd never had the government closure, if that had been done or encouraged earlier, we would have been in pretty good shape. So the timing makes a big difference in some ways, even more than the severity. Just doing something is what we need. Okay, so I said that about the timing. I mentioned a little bit getting into this one-size-fits-all approach. Probably not the best. We should be targeting across age groups, targeting across different people. Different subgroups are differentially impacted. So that's the sort of transmissions, the disease impact on people, on their outcomes and behavior. But also different people have different impacts on the transmission. So different people are seeing different numbers of folks. They're having, they have different employment styles, different types of jobs, working in different sectors. We should really be taking advantage of that on the policy side and targeting things and doing what we can as strategically as possible. Hopefully, we're not going to see a second wave. Not clear yet. I'm American, as you may be able to tell from the accent. Things aren't going so well in the US. There's still the first wave there, but we'll see how it goes. But even without a second wave, as we're reopening now, bars and restaurants just opened in the UK, where I am over the weekend. And so a lot more indoor gathering. We'll see what happens with that. I think we can use some of these early results from the closures to tell us what to do about the reopening and what to do if there is, unfortunately, a second wave. So I think I'm just about out of time, but we have another hopefully 10 or 15 minutes for questions, and I'll see where we're at with that, and hope we look for some of those. Thanks for your attention. Okay, I see at least one question so far for finalists. The question is, what's the uncertainty estimate on people's responses to questions? Yeah, so good point. It is, I think one of the graphs there, I didn't point it out, had confidence intervals on it, had 95% confidence intervals. We have a sample size of 1,000 in each country, which I would say is decent. It's certainly not bad, but it's not perfect. So it's going to be probably about a few percent on those. So what's the takeaway? What's the implication of that? I would feel pretty confident on making some of the judgments about trends and qualitative differences. So saying it's more, there's a bigger impact in this income group or this age group than another, or in one country than another where we did see differences. I would feel a little bit less confident about taking the magnitudes precisely. So to take a sort of point estimate of it's exactly 43% have had this type of job loss, and feeding that into a policy, large-scale policy prescription. That being said, that's my sort of stock researcher response, and I believe it, and I think it's the right thing to say. But given that we're making choices now, given that policymakers have to make a decision, they can't wait a year to have the full understanding and to have the better research, and there will be much more and better research coming along than what we've done so far. Given that they don't have that long and they need some numbers for a lot of this, I wouldn't say necessarily just take my numbers or our numbers here, but if they have to plug something in, I would feel confident enough. We did try to be careful. We piloted the questions. We did a representative sample, and it's large enough that I wouldn't be super unhappy if they had to use something and this is what they use. But there certainly is plenty of uncertainty, and there's certainly going to be much better data that's already started to come along, and will continue to come along. Let's see. Is the behavior of people not different during release of the lockdown compared to pre-lockdown? In particular, the desire to socialize again? Absolutely, and this cuts, I think, a couple of different ways of what you're getting at here. So they're not going to pop right back to what was happening before, and I think there's going to be a good side and a bad side of that. You're alluding a little bit to the bad side, that there's this sort of pent up demand. That's not a bad thing, but that it may be more risky. Bad in that sense in terms of riskiness. They may be going out and doing it, especially in the short term. Now that things are just open, I think the pubs opened at 6 a.m. on Saturday in the UK. I didn't go out at that point. I didn't see what it looked like, but there was probably pent up demand. So there may be a spike. There may be a spike that comes up soon in the UK because of that. On the other hand, I think they're not going to go all the way back to pre-COVID behaviors, because now everybody does understand that this is an issue. I think there's going to be a little bit more social distancing. There's going to be more mask wearing. There's going to be a little bit less travel if it's not really necessary. So I think there's sort of a good side and a bad side to that. I would also say our results about, but I would frame as a good thing, as a positive thing, that this voluntary behavior change was quite impactful and did a lot even without the lockdowns. And I don't want to say lockdowns were a bad idea, because I think they were necessary in some cases, but they were very strict and they hit a lot of people really hard. And I think there's a version of this we can do without the full lockdown for everybody if we need to. But by the same token, it means once we open up and the government restrictions start to ease off, what really matters as much is what people choose to do. So we can't just look at where the guidelines are and where the regulations are. If people are, as you're alluding to in the question, or people are sort of popping back to their earlier behaviors quickly, whatever the regulations say, and they weren't following all the regulations along the way, as we all know, then that can be risky in terms of transmission. So that's, I think, another reason why it's really important to look at what are people actually doing and how does that vary across cultures and across groups and across time. More. How robust are these results? Can you say a bit more on that? You mentioned briefly you're not very sure about the causality of the findings presented. So right, so there's a couple different dimensions of robustness. I already talked a little bit in response to the first question on sort of the sample size and uncertainty, which is totally legitimate area on the robustness. You mentioned the causality, you asked about the causality, which I mentioned, right? So what would be the issue here? The issue is we don't have a way to say that for sure it was the impact of, let's say, the mobility decline or a school closure or a travel restriction that caused the deaths, 18 days later. So the worry as a researcher, as a social science researcher here, the worry would be there's some third factor, let's say, that it was, media attention that drove the decline in mobility and also drove the decline in deaths later. So I think there is a real chance that we can't rule that out, as I said. The reason I'm still willing to sort of present this, and we're working on this paper, and we're putting the results out there, and we hope that it's useful for folks, is that it's harder for me to come up with a story that would really be driving. There's no reverse causality here. It's not the deaths 18 days later, because we do have this chronology in there. It's not the deaths 18 days later are causing the reduction of mobility 18 days earlier. We know it doesn't go that way. It could be a third factor, a confound, and I think that's probably part of it, but there wasn't anything obvious we could think of. I should also say, as further research, we were trying to get this out there quickly and do something and have something useful. There's more sophisticated research coming along that's using different statistical techniques, econometric techniques, instrumental variables, and other things to try to get a causality. So we'll see what those results are, and I'd see those as refinements of what we're doing. And frankly, I would trust those results more, but you need more data for those. The timing is taking longer. So I think it's useful what we have so far, but with the caveats, and they're real caveats. Just trying to be helpful for the policymakers, as they're in a difficult position now, and individuals are in a difficult position knowing what to do at each point in their lives. Do we have any information about how the economist modeling has been incorporated in policy responses? Not a lot, a little bit. I have felt, I'll betray my bias here. I felt that as much as I've worked a lot in public health, worked with public health people. My mother's a nutritionist, has a degree in public health. And what's great, we need to listen to the epidemiologists and the public health folks, and David knows this as well. That being said, I've felt that the social scientists have been given a little bit short shrift in the last 4 months, because we need to know the public health side of it and the medical side of it. That's absolutely crucial. Only those people can do that, can talk about the spread of the disease and the transmission. But those are just inputs to the decisions that the policymakers and individuals have to make. Those can never be the final say. So if we know that lockdowns make a difference or not, that's crucial, but that doesn't tell us whether to do a lockdown or not, because we need to weigh the overall costs and benefits. And to me, that's an economics question, or at least a social science question. And so I would say there hasn't been as much policy influence given, although there has been a lot of discussion about the sort of financial costs, but I think it hasn't really penetrated. And there's been this sense that, no, we have to just focus on the disease. And I understand where that's coming from, and I would put a lot of weight on that, but I wouldn't put 100% weight on that. So hopefully there'll be a little bit more and more for these kinds of things. And there has been some, as I said, I had some discussions with the government of Malawi, which is nice to see them taking that stand. If any other governments want to reach out, I'm happy to talk to them. I haven't so far. Let's see again. see, I'm not sure if I'm missing somewhere. There we go. I'm trying to scroll down. Can the results be updated quicker by using data that's now openly available so the update is possible more frequently than 3 months? So I don't know if this is for the first or second set of sort of the project. For the second one, yes, we're updating the results regularly. It's been a few weeks now, but it's pretty regular because we can start using the reopening data to see what's the impact of that along the way, and the mobility data in reverse from what we've done so far. For the first project, the 6-country survey, yeah, there's a lot out there. There's a huge amount of data out there, and that's fantastic. And people are sort of putting it all together. That's part of it. So if we went back, it would be more to have just consistency with what we've done so far, to ask the same set of questions to, if not the same group of people, but chosen the same way in the same set of countries to see this time series over time. But there is a lot of data out there, and that's a good thing. So it's just a question of funding. It's just a question of getting things put together. But we're a drop in the bucket at this point. I think we were one of the earlier ones, and that's great. But there's a lot more out there now. What are the policy recommendations in the case of a second spike? Great question. I talked about that a little bit. I think it's really about being smart and 80-20 rule, getting 80% of the benefits for 20% of the cost. So really focusing on the vulnerable groups. We know a lot better what they are now. We know a lot better what to do, but providing the support. So, and I think a lot in terms of, I said at the beginning, developing countries as well, where it's not so easy to say, all right, let's protect the elderly and those with comorbidities. Well, okay, they need income too, they need consumption as well. So you need a strong social support structure. So these two things need to go together, where you're maybe isolating these groups, but also providing the support, getting them food, getting them other consumption, other vital services that they need. So that would be one thing I would say. Lots of testing, there's lots of smart algorithms coming in now about group testing and multiple testing. The technology is getting better and better. So the testing and tracing. I mean, basically, I think my goal would be, we need to get people back out there working. We need to get kids back in school for the fall, 100%. It's super important for them. We know very well from lots of data of all the, frankly, really bad things that happen when kids aren't in school, not just for their own education, their future outcomes, their health outcomes, what happens at home, not to mention the adults, parents working, but even just for the kids. So we need to get the kids back. We need to get people back working, but we need to do that in the right way. And so figuring out who are the right groups, so we can let as many people as possible out there and support and protect the others. And what are the right ways to do it in terms of masks are probably important, but we don't know how important. Hand washing, well, it's a little less focused on that now because the fomites, the surfaces don't seem to be as much of a transmission as compared to aerosol transmission as we thought before. So really paying attention to these differences rather than a sort of one-dimensional, is it a lockdown or not, or how far on the lockdown spectrum do we go, but thinking about what version of a lockdown. There's one more here and then I'll stop that I saw just to let it get to. Julian, do you think politics has impacted different nations' policies and approaches toward COVID-19 more so than we've seen during any other public health crisis? It's a good question. I'm not sure I'm qualified to answer that. Probably so. I mean, I would say politics has a big effect in a lot of cases, but everywhere, but including public health. So I'm not going to minimize that elsewhere. But I do think this one, because it has been more of a crisis and because it has been on everyone's minds, which is probably a good thing, but certainly unavoidable given the scale of the pandemic and how severe it really is, I think that's just made it more political. It's made it part of the media, part of the general discussion rather than a sort of technocratic. I'm not saying that's always the best thing. Politics is not always bad. Technocratic is not always good. My bias is going to be a little bit more on the technocratic side, and I think that's been left out a little bit too much here. But probably because it's been, a bigger thing, has been more political. My hope is that we can get something good from that public health stays as part of the broader discussion and the general political discussion going forward, and we don't lose sight in the next 6 or 12 months, because I think it's good for people to think that, to be pondering it and imagining it, and part of that discussion, thinking about public health things and protecting us in the next 12, 18 months, but also for future ones which are going to come up in the next few decades. Thanks again. As I said, feel free to reach out otherwise. I'll turn it back, I think, to David now for some final words, and I appreciate everyone's time.
Hi, everyone. Thank you very much. I have to say, I was surprised by the presentation. There was a lot here I just didn't know. I'm not even really sure how to assimilate it. I think like many of us, I just assumed we had to lock down everything, right? And hope for the best. To see this kind of careful analysis is really very, very interesting. I have a lot to think about. I think that makes this a fantastic session. Julian, really, it was great. I very much appreciate it. I hope everyone enjoyed the session as well and can come to the other sessions. I just wanted to conclude by thanking our team, our alumni and events team, Josh Papanicola, Charlotte Leach, Ruth Waterfield, and Josh, I think I pronounced your name incorrectly. Apologies. But thank you all very much, and I hope to see you again soon. Bye-bye. Thanks very much.